So women face a lot of unknowns, unfortunately, when weighing what options what to use during pregnancy, because we don't have great data on the use of antiretrovirals during pregnancy. And the session at CROI where we discussed this really talked about how women have been traditionally excluded if they're of reproductive age or pregnant from trials, and how we need to completely flip that around and justify our exclusion and not justify inclusion. But at this moment, if you look at all the antiretrovirals that are available to treat HIV in 2019, which is amazingly wide swath of medications, and it's exciting to treat HIV in 2019 with all these options, you had to take away so many of those that are at least not recommended, or we don't know enough about them during pregnancy. So in terms of the safety of PrEP in women of reproductive potential, PrEP is safe. There are some theoretical concerns that women who are pregnant taking TDF and FTC, there can be some little bit of bone effect on the fetus. Not a big deal, not something that in a risk-benefit analysis overwhelms the amazing benefit of being protected for the risk of HIV during pregnancy. If one gets HIV during pregnancy, there's such high viral loads and there's a very high rate of transmission to the baby. So not good for the mother, not good for the fetus. And so if you're at risk, take PrEP. That is the right thing to advise, we as providers to advise women who are at risk during pregnancy, take PrEP. So right now there's a big gap between FDA approvals for medications and then having data in women to inform providers so they're not flying blind and figuring out what to use in women. And the way to shorten that gap is for drug companies to actually follow FDA guidelines, which the guidelines, and they're not mandates, they're guidelines, and there's really debate about that, but the guidelines say enroll adequate numbers of women in your study to look at a drug's difference to perform sex-delineated outcomes, look at sex-delineated outcomes in your study. So if we enrolled enough women to begin with, then we would have data on men and women by the time that FDA approval is even filed for a drug. So that is the recommendation by the FDA. It is, however, not a mandate. And because it's not a mandate and drug companies are in a hurry, they often do not take the time and the care to enroll adequate numbers of women. And that is true, by the way, for racial and ethnic minorities as well. So what would be important is the question of, can we make this a stronger recommendation to say enroll adequate numbers of women? Can we say that if you're pregnant, you should be allowed to be in the trial unless there's a very good reason not to? And so all of this is being looked at now, and I do have to say that I think changes are coming.